My name is Dr. Bayati. I'm here with the Endolift team and my colleague, Dr. Matten. Thank you for joining this morning's Endolift special edition, I guess, where we are carrying out a facial Endolift treatment, and next door you'll get to see a body Endolift treatment as well. The session should take approximately about 1.5 hours of your time, so hopefully we aim to wrap up at around midday. So in the interest of time, we'll get right into it. I've got my patient Anna here, who is going to be our model for the face and upper neck Endolift treatment. We will probably have a conversation around Endolift and techniques, indications and so on whilst we're carrying out this procedure. So Anna, if you stand up for me, sit up, sorry. I'm just going to mark out some important safety landmarks here. Turn this way. Chin up for me. The initial preparation is very important and it takes about 10 minutes. Involves marking out key landmarks, preparing the skin and also local anesthesia. If you sit back for me. Are you comfortable?
Yeah.
Cool. There you go.
Yep.
Thanks.
Ready for anesthesia?
Yeah, please, with the gauze as well.
Where did you put the gauze?
How do you feel, Amber? Anna, sorry.
I feel fine. I'm not even particularly nervous.
That's
I'm excited about it.
So whilst we're waiting, this is the Endolift device. It's got a complex set of intricate settings which, when you do more and more of these procedures, you'll become familiar with. And that's the beauty of it, is you can refine these and make it very patient-specific. Skin tightening versus fat lipolysis versus a combination of both. And in Anna's case, we're opting only for skin tightening. We will want to preserve some of the fat content. So I'll take you through this when I start. We'll just perform the local anesthesia first. There you go, thanks.
okay. Sorry.
In my experience, this is probably the most uncomfortable bit for a patient. Local anesthesia always stings. There you go. What do you think, Matten?
Yeah, this is the only part which is uncomfortable after this. When the numbing takes effect, really don't feel much. But we also use the bacteriostatic saline to dilute it, so that should sting a bit less. You okay, Anna?
Yeah, fine, thank you.
Perfect.
Okay, here we go. This is probably the most painful bit of the next 60 minutes that you will experience.
What is the solution you use for the anesthesia?
This is 50-50, 2% lidocaine, 5 mils, 10 mils in this syringe, and then 10 mils of normal saline or bacteriostatic saline.
Bacteriostatic to reduce the sting.
How long will last the numbing?
Approximately 60 minutes. What I tend to do is numb both sides and then under the chin and then start. Takes you about 25 minutes to do one side, and there is still sufficient anesthesia on the other side when you're starting on the contralateral side.
So have you guys ever tried sodium bicarbonate mixing with the solution? Because sometimes it reduces this.
I'm actually
The sting, yeah, Torbrock. We do use that, yes, to reduce the
Yeah,
sting
I've-
of the
I've recently
injection.
started that, yeah. Some of the other Endolift practitioners have recommended that. Have you started
I
doing
do
that?
use that,
Yeah.
yes.
How do you feel? Is it all right?
Fine, thank you. There's a
Good.
tiny sting, but
Yeah.
nothing bad.
I think to me this is the most important part of the procedure. is taking your time with local anesthesia. The last thing you want is an uncomfortable patient.
Absolutely. Do we have coolers here, by the way?
Can you change the syringe? I'll just do the other side.
You want to change the cannula fee?
Yeah, please.
Yeah.
Let's do the other side. And look straight. Perfect. Good. Thank you. So from the outer part of the zygomatic arch, the jawline angle, these are my two insertion points. Needle back.
Yeah, I'll take.
Using a 22 gauge cannula. And if you're familiar with cannula-based injectable treatments like dermal fillers, then this is pretty much similar in technique. I find that this is the most sensitive part.
Yeah.
I do a lot of anesthesia here. Yeah, a lot of patients will have more sensitivity here. I'm not sure why. Probably more concentration of nerves.
Probably. I sometimes, to be honest, I don't even dilute my
Really, you go neat.
things. Then I don't inject too much of solution in there, and
Yeah.
we'll have less swelling.
Yeah. Nearly finished. Okay, and last one is
Submental.
the submental region. Thanks. Would you not? Just in. There you go. Okay. Okay, there you go, all good. So whilst we're waiting for this to kick in, and it does kick in very quickly, I'll just talk to you briefly about indications. I think patient selection is crucial when it comes to achieving a successful outcome with a successful cosmetic outcome with Endolift. And the ideal candidate is someone with moderate thickness of skin, moderate amount of fat tissue, heals well, and in particular, a patient who understands the short downtime afterwards, mild to moderate swelling, mild numbness of the tissue that can persist for several weeks, anywhere between 4 and 8 weeks. But if you are results driven, then in my experience and my other colleagues performing this, it currently offers the best solution to skin tightening and lifting in a non-surgical outpatient environment. Okay, so the hard part's over. I'm just going to change my gloves and then we'll start treating the right side.
You all right?
Yes.
And, can you smile? Fine.
Yeah, fine. Oh, Valentin. You just ruined my hair. No, I'm joking. All right.
Vale, recuerdo. In switch.
Chin up for me. Turn this way. Good. The other way. Okay. Head up slightly. A bit more. That's it. And down. I'm just going to apply the goggles now, yeah? So, good sleep. Thanks.
All right.
Do we have, can you just get me a...
Suggest those.
Of
Yeah,
course.
go for it.
Would you?
Gauze with a bit of liquid. Thanks.
Shall we go on the settings now?
So this is important. Maybe we can have a quick discussion about this.
Yeah. So we want here. We don't have much of adipose tissue, so you're aiming for skin tightening only, right?
Yeah,
Perfect.
exactly. And specifically in Anna's case, she was quite clear that she wants to preserve some of the fat tissue.
And that is necessary.
That's important,
absolutely.
exactly, in certain patients. And therefore, what we do as practitioners is adjust the settings so that we're focusing more on addressing skin laxity rather than fat lipolysis. So there are three main components: the power, pulse, and the type of probe, the diameter of the probe that we're using. Power is measured in watts. In Amber's case, 2.5.
255.
Yeah. And in terms of the pulse, that determines how much energy, how much of the laser that's actively firing versus the relaxation time where it's not active. So we refer to that as time on, time off. And in Amber's case,
50.
I would think
50,
probably
50.
60-40.
60.
60-40, yeah. Little bit more time on.
We want to do skin tightening. Yes,
Yeah.
let's do. Probe, is this 300
This
flat?
is a 300. I think these ones are automatically
Oh, so
set.
it's,
Yeah, the direct to
Good to go.
device.
Do you wanna
Yeah, please. Okay. So here we are. This is really where the main technology lies with Endolift. It's these ultra thin fiber optic wires that transmit consistently the laser signal to the tip here. There's a pedal which, when you press, activates the laser energy, and the heated tip allows you to just pierce right through skin. So no incisions, no scars. Chin up for me. And if you turn this way.
Have you given her nerve blocks?
Sorry?
Have you given her nerve blocks? Or
Just local anesthesia.
local anesthesia?
Lidocaine.
so you've infiltrated the whole cheek?
All the areas that we're
And
treating.
submental and the neck as well.
So to listen. And what wavelength is this? Is this the specific wavelength?
The machine or this treatment? This treatment, the setting is here, so we went for 2.5 watt and yeah.
1460.
Are you feeling you're right,
Yes, I'm fine. Absolutely fine, thank you.
What are you feeling at the moment?
Mark? We have a cooler here.
I'm
Cooler?
I'm putting pressure,
Cooler.
but that's it.
Okay.
And I can hear a crackling.
They don't
noise.
have it?
Yeah. So we're fairly superficial. And this is something you develop with experience. You learn to appreciate the depth that you should be operating in. we do want to address the deep dermal layer. And then, of course, you're targeting some of the superficial fat. But below that, the facial muscles, the deep, important structures, the major nerves, the major arteries are much deeper than that. And this wouldn't, this is not deep enough to cause any injury to those structures. So it's a uniform back and forth motion, trying to use the same amount of the same speed of movement. And you'll see with my non-dominant hand, I'm putting a bit of pressure on the probe just to try and consolidate the delivery of the heat and bring the tissues together. Okay, so you felt that a little bit.
Yeah.
So at certain times of the procedure, you will feel a little bit of discomfort like that, and these are the borderline areas where you don't have anesthetized tissue, the regions that we're not treating. Does that make sense? In a patient who's got predominantly symmetrical features, you try and deliver the same asymmetrical amount of energy to both sides. But there are actually very few patients that have symmetrical facial structure. And so I often find in my practice, I treat one side a little bit more than the other to try and bring back some symmetry. Turn to the center. And back the other way. So immediately after treatment, you'll see some erythema of the skin that's treated. That usually persists for less than 24 hours. On a cold day like this, it will probably be quicker than that. There will definitely be some swelling associated with this. One second. There will definitely be some swelling associated with this, which usually
sticky ones.
I think if we prefer these ones, I think just for comfort, you just tie a knot around that.
I'll do it.
The swelling usually persists for about 2 weeks. It usually reaches maximum swelling by about 7 days, and then gradually starts to subside. When you're trying to melt fat, then you're using higher energy settings, and therefore inducing more controlled trauma, and that will naturally result in more swelling and a little bit more of downtime, so usually around 3 weeks. And if you turn this way.
So from 1 to 10, how painful this is?
Can you cancel that, please? Just cancel the call. Sorry, from 1 to 10. Swelling or pain?
Pain.
I'll let Anna answer that.
At the minute, I can feel in certain areas a prickle, and I rate that as a 2. But for most of the face, near the kind of side areas, I can't feel a thing.
Very good.
Yeah, sometimes they feel a bit of heat from the delivering the energy. So if you have a cooler and constantly cool the patient down, that would also help.
It literally is no more than a prickle. It's not bothering me in any way.
It's fantastic.
like having a facial done, no?
I tell you, microneedling is a lot worse than this.
Especially RF microneedling now. So what's the plan? 500 you're doing in cheeks, or
I think so, yeah. 500 for the cheek buccal area.
350 on
Yeah.
the sides?
Yeah.
Should be enough.
So some of you may wonder what the these landmarks here that I've drawn out are, and this is the expected course of the marginal mandibular nerve as it penetrates the platysma and it comes out superficially. The main indication of that nerve is in maintaining lip position, particularly when you're smiling. And when you're using subcutaneous devices like this and you're applying heat to the area, you can get bruising to that nerve. In a very small percentage of patients, temporary bruising to the marginal mandibular nerve can cause an asymmetry in your smile on the side that's bruised. Now, this is temporary. Usually resolves fully by about 6 to 8 weeks, and actually in a lot of patients it's much quicker than that. But that's something that we specifically consent for and discuss with patients. And there are ways that we reduce that risk by creating a safety margin where we try to avoid charging the laser in that region. Back to the center, big smile with teeth, relax. And periodically I'll ask a patient to smile with teeth to assess that. So I'm constantly assessing my, the risk to this nerve. So I quite like working around the jawline area. And I spend a little bit more time around there to try to achieve some contouring as well. And I find that usually works very well with Endolift, is you're able to contour certain structures like the cheekbones, the jawline angle.
Dr. Bayati, tell us about your experience. How many patients did you treat, and was the results achieved?
I've treated about 200 patients so far over the last 12 months. I carry out about 3 or 4 of these a week.
So just my goggles for a second.
Probably just need to be,
coming off again.
And you continue to learn, you continue to refine your selection criteria as you build your experience. I feel I'm at the stage where I'm able to select patients appropriately, where I can offer a good cosmetic improvement. But me personally, I think it's transformed my clinical practice. It definitely does allow me to deliver non-surgical results that are not achievable with injectables alone, and not achievable with other laser devices such as Morpheus 8 or high-intensity focused ultrasound. And that's because this is a little bit more invasive, subcutaneous, and therefore you're able to achieve more impact and more biostimulation of the tissues. About 40% of my patients will, chin up for me, will have a small amount of filler treatments at the follow-up, usually around 3 to 4 months, to fine-tune the process. And I think that combination works very, very well.
Is it one session? Do you do for them?
Depends what the starting point is for each patient. If you've got patients with moderate skin laxity, moderate adiposity, then it's unrealistic that you're going to be able to, you know,
Can you do a PG test?
get
to see the
significant
difference,
improvements.
please?
Chin up for me. You can see it from here if you come from above. So this is the untreated side and that's the treated side. You get immediate skin retraction, skin contraction, and therefore you get that immediate firmness. This is also one of the procedural endpoints, is when you feel that firmness, reduced ability to pinch compared to the other side. That's when you can be satisfied that you've arrived at a good endpoint for that area, and you can move on. And you'll notice that I'm also looking back at the parameters on the machine to see how many joules I've delivered.
Somebody's asking, how is Endolift compared to Ulthera?
Do you have Ulthera in your practice?
I don't have all therapy, so can't really comment on all therapy. But Endolift is unlike most devices. This is one step closer to surgical. Most of the laser devices currently, or even the like all therapy, thermage, radio frequency, they're non-surgical results. They're good results with them as well, but this one is one step higher, one step closer to surgical. It's kind of filling that gap between non-surgical and surgical. It's a little bit closer. Still, it's not surgical. It doesn't deliver the surgical result, but it's very close.
Ulthera is a form of HIFU anyway. So
Yeah,
it's not
so
comparable.
it's not comparable to this in any way. We have quite a few different devices.
How long has this procedure and technology been in practice? 8.
8 years, yeah.
And what about radio frequency macroneedling comparison?
Well, that's as well, like we have Morpheus 8 in our clinic. It's a fantastic combination. Yeah, this treatment, you can combine it with several other procedures. So we combine it
Feel
with
a
the
little bit more
thermage, we combine it
discomfort
with
here, okay?
Morpheus 8, we
Just
combine it
treating
with
the upper
HIFU.
neck,
So it's a really, really good
but you'll feel
combination
some
with
of the
other
tissue
treatments,
that's
and
not
also with
anesthetized.
injectables.
Fillers,
Not
the
only
mid part
fillers,
of the
for
neck.
example, if you combine it with Profilo, combine it with the skin boosters like a Hydrodeluxe, all of those, it's really, really good.
Not so
And it
far,
works
no?
much better on hydrated
feel
skin.
that?
So if you hydrate the skin in advance with something like a Profilo, this works way better.
Suitability, all the skin types are suitable?
It is suitable for all skin types, yeah. There's no PIH or anything like that afterward.
Risk of
No,
loss?
I'm not feeling anything.
Good.
None, I haven't seen any, and I haven't read anywhere about risk of melasma, because you're in totally
Back
different
to the
level.
center.
You're in hypertension level.
Risk of fibrosis, like intradermal subcutaneous fibrosis, by creating that internally rather than externally, like hyper.
Yeah, you know, it's very unlikely. It's one of the indication of this machine is when you have a patient with lots of fibrosis because of previous threat treatment or other treatment. This is what we actually remove the fibrosis with. This is what we dissolve the fibrosis and the granulations with this. So it is on contrary, this is the treatment for those fibrosis.
When you have patients with adipose laxity and skin laxity, do you vary the parameters when you're dissolving the fat and when you want to stimulate?
Absolutely, absolutely. That's what Dr. Beati explained at the beginning. The parameters are quite controllable. So when we want to remove adipose tissue, when we want to remove some fat there, for example, if they have some submental fat or adipose tissue, we change the parameters, we increase or decrease depending on this. In Anna's case, we didn't want to really remove much of fat because she doesn't have that much. So we decided to go for skin tightening. Of course, we will have a little bit of the removal of superficial adipose tissue, but that's only very minimal. So the aim here was skin tightening.
So for this side of the face, the right side, there was about 900 joules.
Yep.
Yep.
I guess it's going to be replicated on the other side.
Exactly, yeah.
In average, is
Exactly.
this like 1,500 to 2,000 joules you deliver?
Quite depend on the patient and the
The
size
individual,
and
yeah.
what you want to achieve. Even if the patient have an asymmetric face to start with, you can deliver more on the side, for example, that you want. So you can play with it. I've got quite a few patients that we specifically did this treatment to achieving some symmetry on the face, and it was really good. It was really good. You know, if patient have one heavy side, rather than making the other side heavier with fillers and injectables, but that's what normally people do, you can use these to achieve some symmetry. It's really good for that.
And
But by the looks of it, one side of the face needs like the minimum is probably 500 to 700 joules. If you think about like cheeks, lower jawline, and neck.
Yeah,
That's probably
you treat in compartment like we usually do cheeks, side of the neck, mid neck, and the other side as well. So it's like a 5 compartments little compartment you treat. And yes, depending on the amount of the tissue that you want or amount of the contraction that you want to achieve, you can decide. But here we decided to go about 500 on the cheek, about 350 to 400 on the neck, and we probably do about 450 on the submental area as well.
So I'll just do this bit and then hand over to you, probably, Matten.
That's all right.
We've got another question here. Can this treatment be used around brow area for lifting or lifting around the eye area?
This is something we're exploring at the moment, and we have some very experienced colleagues abroad who are specifically doing this with Endolift and are producing some remarkable results. The skin retraction that you get and the lifting, in principle, can help to lift the brows and address periorbital heaviness. So I think that's an area I'm certainly interested in it, and will probably start to explore that very slowly. But others are already doing that abroad.
We've got a few people asking about the settings, the laser.
Yeah, well, as we both explained, settings are completely different for every individual. So usually you get a full training on this machine but if you have a specific questions, you can always forward your questions to Marco or us, or even a picture of the patient with consent, and we can recommend a particular setting that we think
it's the
is
inner
right.
part, isn't it? Yeah. Bits that I haven't anaesthetized. So if you give us the worst amount of pain, what would you rate that out of 10?
3.
Okay.
That's still quite all right.
No, sorry. As a discomfort.
It's just a discomfort, a push-off.
And if you use a cooler with it here, because of the setting we didn't, you probably reduce that to 1 or 2, even a bit more. You use air cooler with it in the clinic?
No, not routinely.
Not routine.
But I know that other clinics, some of the other clinics do.
Yeah.
Yeah, more for comfort.
Even some of our colleagues in Italy, they don't do anesthetic at all. They just do with a bit of cooler and they do their treatments.
With cooling, yeah.
Yeah, Roberto spoke with them.
Less downtime, isn't it? Because the most the swelling will come from actually.
Yeah.
To be honest, swelling is very minimal. Never had anyone complaining too much about lungs and swelling or anything.
In my experience, it depends on what the main indication is. If you are using Endolift for lipolysis, for laser-assisted lipolysis, then naturally you'll be using much higher energy settings, delivering more, and that will result in more trauma. So in my experience, these patients will have swelling that persists for around 3 weeks. But you know, as a future patient and even future clinicians who are thinking about this, if you are results driven, then I really don't think there's anything that comes close to Endolift currently, non-surgically.
And how many months later typically do you see?
I don't follow my patients. Yeah, I don't follow my patients up until 3 months usually, even 4 months. By that point, you'll expect to see mild to moderate results. Full-term effects, I judge full-term effects from a single treatment at around 6 months. That's my endpoint. And I'm seeing patients now that I've treated about 10, 11 months ago. And what's fascinating is the results seem to continue to improve at that point. No, there's a pedal that I'm
There's a pedal,
controlling
you know, you
on
can
in my
stop.
left foot.
Should be always on motion, so we don't fire in static mode, because that's
Yeah.
where complication can arise.
But it's not a continuous laser beam, it's a
Pulse.
Of course, yeah, it's a pulse beam, so it's got like a T on and T off, which is the time that the laser is on, and the tissue relaxation time as well.
Notice the best results after how many months?
4 to 6. Yeah, 4 to 6, and at that point, that's when I determine adjuvant treatments like injectables, fillers, to just enhance certain features, like the cheekbones or the jawline angle. I mean, I have some very good examples of that, and you can really see that the results can be quite dramatic. Very natural looking, but not the type of results that you would normally expect to see with a non-invasive treatment.
So you say this is more really good treatment for the people who have a round face, which way you can help with the loss, shaping and countering the face.
Yes, yes. It does help with contouring, yeah, and if you're trying to restructure the face or reduce heaviness in the lower face related to fat. I have to say there is a threshold. You know, if you have quite significant fat tissue, then endolift really isn't the right approach. So you also have to be realistic, and that does come with experience and following up your patients. But I would say Anna is a perfect patient for endolift. She's got moderate amounts of laxity, little bit of heaviness in the lower face, and endolift will help address all of that.
You can combine it always with the other, for example, in our clinic, somebody with round face, too much adipose tissue, we do cool sculpt, 1 or 2 round of cool sculpt, reduce the bulk, and then after that, because they end up normally with a bit of loose hanging skin as well, when we do the endolift, it will just get that final touch really.
Cherry on top.
Yeah.
Absolutely.
Yeah, a lot of people ask me about that actually, whether removing fat will create loose skin. And that's one of the disadvantages of surgical liposuction. It's physical removal of fat tissue. You're not addressing the skin layer. Whereas this is both laser lipolysis and laser skin tightening. You get a combination of both. I must stress the results are not what you would expect to see in surgical liposuction. You know, that's much more invasive, and there's more control as to how much you can remove physically. This does have a sort of large biological component to it, where you wait and see how well the patient's body responds, how much fat is absorbed, how much bioremodeling develops. And I think that's why even if you use the same setting on 10 patients, you will have 10 patients who experience different cosmetic outcomes. You've probably experienced that with your patients as well, right, Matt?
Absolutely, yeah, that's absolutely true.
How many sessions you can have? Is a month apart if somebody needs a multiple sessions?
No, a month would be too soon. Too
Oh,
soon.
okay.
Yeah, you're still healing at that point, and it's probably not safe to do so. If you were to administer another round of treatment, you're probably going to increase the risk of complications like infection. I wouldn't treat anyone as early as 6 months.
6 months, I would say 6
Yeah.
months, definitely.
And that's for patients who have more significant laxity, and it's going to be a bit more of a work in progress, where you try to get incremental improvements. For someone like Amber, she probably wouldn't need to consider this for about 2 to 3 years. For someone younger than her who already has good quality skin, a decent level of firmness, they probably wouldn't need to repeat it for 4 or 5 years.
Because one of the advantage of endolift is the progressive results. So up to 8 to 9 months, even you still get a result, because it's all
Okay.
stimulation. So you're stimulating.
Non-anesthetized tissue.
And we know collagen remodeling typically takes around 5 to 6 months. So I wouldn't do
Yeah.
repeat before that.
And what dilution of anesthesia have you used? How you dilute the xylitol?
We did 10 ml of the 2% lidocaine with the sodium hypochlorite bacteriostatic.
Sodium
So
chloride.
50-50.
Without epi. Without epi.
Yeah, without vasoconstrictor.
So 50-50.
50-50. Yeah. So
What
that
about-
makes it very comfortable. As you see, patient was pretty comfortable and rated the discomfort 3 out of 10, which is quite bearable and decent.
And if you,
Tried it with nerve blocks?
I haven't, because it's not necessary and it makes it a bit uncomfortable for
back to
patients,
the center.
because this is
You're not
quite
feeling it?
decent.
Smile. Big smile of teeth. Relax.
How
Perfect.
soon can you inject fillers on patients after the treatment?
Well, because it takes a while for the result to see and for the lymphatic drainage to happen. I would say I will leave it about 3 to 4 months before I decide to do the filler injections to contour the face.
So I've just treated both sides down to the level of the jawline, parts of the upper neck as well. I'll hand over to you. Do you want to finish up with the submental?
With the submental, yeah.
Amber, it's going to be the same process. It's already been anaesthetized. This will probably be a bit shorter. And it will help to just create a little bit more retraction in this area, particularly in patients when they look down and they see that laxity. Okay?
Great, yeah.
How are you feeling?
Very good. I'm struggling to stay awake actually.
Michael, gloves. No, where are the gloves? The sterile ones?
There are some surgical gloves, 7.5.
Yeah.
7.5.
7.5 is fine. Thank you.
So for the neckline, will it work for the neckline as well?
So the neck is a very complex area. It's multi-layered, and remember, we are only working in the superficial tissue. We're only addressing the skin and the subcutaneous tissue, and even technically, it can be quite
You want to
difficult
wear
because it's
that?
very thin.
You want me to wear that or you're fine? I'm
And
just doing the submental.
I
It'll
do
be
think
5 minutes.
yes. So you will see good cosmetic
If we
improvements.
can skip it.
I don't think it's the
Yeah.
same as the face, and it probably is the type of area where you would retreat in the future, particularly in Anna's case. I have patients where I've treated with facial endolift. 6 months later, they feel that their face is too young for their neck, which is testament of the good results it creates. And then those patients often want their neck treated at that point. There you go.
Can you bring the table a bit
I'll
up?
bring it up.
So yeah, I'll
There you go.
thank you. I'll do standing.
One second, let me just do it for you here. You want table up, yeah?
Yeah, just because I'll do this part standing.
So this last bit takes about 15 minutes.
That's okay.
Yeah.
Thank you. All right, you okay?
Yeah.
We're gonna do this part now.
Increase the height.
Yeah. Let's change the settings slightly, maybe,
You
because
like?
we're still not really doing too much of adipose tissue. Maybe we just go to 3,
3,
I would say. Yeah.
keep it at 60.
60-40, still
agree.
fine. Yeah. It's quite all right. All right. So it's all about constant movement of this.
How long typically does a face treatment face and shoulder?
Sorry?
How long typically does it
Face.
For face.
I think once you're experienced, you can do this in about 45 minutes. Yep. Separate to the local anesthesia.
Yeah.
So this, I find that the preparation, photographs, consenting, skin prep, local anesthesia,
Takes longer.
can take longer. Yeah. Yeah. So I typically book my patients in for an hour and a half session.
Same
That's
as
separate. I do separate consultations, but the actual day of the treatment, about an hour and a half.
Okay, yeah, just pull it a little bit. Thank you. I tend to do all around the face in sitting position, but submental I prefer to stand up.
Yeah.
Yeah.
Yeah. So there are different wires. There are different diameters, and that will determine the diameter of the beam that you're seeing. So the amount of area of tissue that's being treated. This is a 300 micron. I tend to use 400 as well in my practice. I upsize it if I want to administer a higher amount of energy and if I want lipolysis as well. And Rory next door will be using 600 micron.
I have a question sort of like that. That's why I understand what probes do you feel are best for what procedures. I would assume that's which areas, what fibers do you use.
The easiest way to explain this is you start at 200 micron. That's the smallest that you can obtain, and then you can go to 600, 800, I think, for body treatments. So remember that reflects the diameter of the circular laser beam. For mailer bags, you use 200 microns, so you use a thinner, more delicate fiber optic wire, and we tend to perform that without local anesthesia. You're delivering very low amounts of energy into this sensitive area. 300 micron, I would say, is the standard for facial endolift. I tend to upsize it to 400 in patients with more volume. And then Rory next door is using 600 for his abdominal case. The flexibility is great. Some practitioners worry that they can fracture the wire, but it's actually very hard to do so. And I think we did it in your clinic, didn't we? We tested it at the end. Yeah, you need to put a lot of force, to try and fracture this wire. So the flexibility is great because it allows you to sometimes follow the natural contour of the patient's anatomy.
How many joules we delivered so far?
You've got, so I stopped at 890. So you're about to reach 200.
Yeah, I'll do another 150.
You're about to reach 300.
So shall we stay at another 50 joule? It's not too much, or 100?
No, I think you can go further. Another 150.
Yeah, it seems right.
So in your practice, who gets better results, male or female?
I don't think it's sex specific. I really don't. Just like with injectables, it all depends on patient selection and how significant the laxity is and how well they remodel.
I think when it comes to the skin texture, female getting better result because they are more into the skin and they already have some sort of treatment, like a hydration or just other medicated product.
So men leave it.
Men leave it like they don't even put the sun cream on.
Are there any studies comparing it to other tightening procedures like HIFU?
So laser lipolysis it's a well-established, clinically proven treatment, and there are quite a few published articles with a reasonable amount of patient cases, and I would advise you to look through those because when you learn how to use the settings, you can apply them specifically to patients to achieve more superior results. And some of those are published in other groups who've used similar cases, who've used similar techniques. The reason why I sort of pursued Endolift is because I think the principle makes sense to me.
You okay?
Yeah, great.
Controlled microtrauma, subcutaneous, minimally invasive, and you're delivering all the energy that you want to deliver subcutaneously. It should have a better stimulate better biological response than the topical treatments like Morpheus 8 or HIFU. If you look at Morpheus 8, for example, micro needles penetrating the skin at different depths, whereas with this you're directly in the layer that you want to operate.
So with the Morpheus 8, they usually go 3.5 millimeter.
3.5, okay.
3.5.
Yeah.
So how far we are down with this one?
Still,
With that range.
yeah, I mean, it's definitely sub 5 millimeter, so definitely less than 5 millimeters. But what I tend to do for some of my patients, those who have moderate amounts of fat tissue, is you can increase that depth and work within the fat plane as well to stimulate more lipolysis. You're not going to achieve that if you remain subcutaneous. Yeah. So that's good. I think that's pretty good.
Yeah.
What I tend to do is
Yeah.
do an insertion point here and fan it across. What
Well,
do you think?
we
This
can
region?
do that. Technically, you should avoid the thyroid gland, but we can do.
So, yeah, where that crease is there, maybe just give her a little bit here, right? On both sides. See? If you come this way, yeah. I like this method. It's
Yeah.
See
All right. Yeah. Absolutely. Why not?
yeah. Are you experiencing much resistance there, fibrosis?
No.
Or, good.
This is also a really good treatment for laser-assisted subcision for acne scarring treatment.
Yeah.
So it's quite good. I combine these with I do
Yeah.
subcision with
Yeah.
Endolift, and I do either RBM or CO2 in our clinic. We get really good result with
That's really good, actually. Yeah. Just releasing tethered scar tissue.
Yeah, rather than normal. You know, the subcision is the gold standard still for acne scar, but laser assisted makes it much more effective because it stimulates as well at the same time.
I think maybe a bit on that side, right? And then we stop.
Yeah,
Yeah.
we're gonna do
Feels
a
good.
bit from that side, and that's it. Yeah.
So last bit, Anna, on the other side.
Sorry if you bring my pedal there. Here. All right.
Yeah.
Last few seconds. Yeah.
Top
Do
of
you
the
have
thing.
antibiotics after the procedure?
I mean, we should use antibiotics sparingly, really, right? I mean, I do know practitioners. I think some practitioners here and some abroad who do it routinely. I'm not sure I entirely see the need. I don't think I see the need for that. You do have to exercise some responsibility on antibiotic use. I have prophylactically prescribed antibiotics for some patients, but I use it very sparingly. And it's in patients who, yes, high-risk patients and those where you've treated quite extensively for lipolysis. And the extent of inflammation can potentially, low risk, but it could potentially predispose you to opportunistic infection. Yeah. But not routinely, no. How are you feeling, Amber?
Absolutely fine. I am just having a semi-nap, actually.
Yeah. We've bored you with our conversation.
No, I've got one ear on that. It's very fascinating.
Sorry,
Hi.
quick my name's Josh. Local anesthetic inhalation first.
Yeah, so
With adrenaline.
without adrenaline.
Without adrenaline. Okay.
Yeah.
And waves in the ultimate result?
Yeah, I think part of that can be, this can be,
Technique, I understand.
it's not impossible. Of course, you can get asymmetric outcomes, but the ways that you can minimize that is refining your assessment. And with experience, you will know whether there's an indication to treat one side more than the other to re-establish symmetry in a patient with an asymmetric face. Most patients will present with asymmetric distribution of fat. If it does occur, and it's not common at all, but if it does occur, then that can be addressed with a targeted
You all right?
session of Endolift, of Endolift treatment, and you determine that at about 4 to 6 months. Okay, I think we're finished.
And
You look to me.
manage the fibrous tissue as well as the...
It will manage the
Well, because of your second on fibrous tissue.
yeah.
In your second is it
Not
powerful
necessarily.
enough to cut through that?
Yes, it is. Yeah, we were just talking about subcision, the role of Endolift for subcision for acne scarring. Let's just it's a bit bright in this room, so keep your eyes closed for the time being. And lift up for me. So there is you, and if you sit up for me, have you got? Do we have a mirror, or do we have a mirror or not? Okay, I'll show you later.
There should be a
Look up for me.
hand mirror somewhere.
And look down. And look up. And if you turn to the side, look down for me. And look up. So this is the extent of treatment, from the zygomatic arch all the way down to the jawline angle and then submental region. We've entirely avoided this area. It's not necessary to treat, designed to minimize the risk as well. The immediate effect is skin tightening, a bit of contouring. Now, a large part of that is down to inflammation and trauma. But this is I often ask patients to have a quick look in the mirror as soon as I finish the treatment, because it's indicative of the potential result they're going to get about 3 to 4 months before the swelling develops over the next few hours to the next couple of weeks. But firmer skin, a little bit more contouring in the cheekbones, around the jawline. This is what we expect to see in Anna's case. How did all of that go?
Really well. I literally almost had a nap. There were a couple of more intense prickles here.
Yep.
And it feels quite tight to move there
Yep.
now,
Yep.
which I like.
So Anna will see some textural improvement over the next few months, as well as the definition and the lifted appearance. In your case, it will probably make the mid and lower neck look slightly out of place because you have younger facial appearances, and that's where targeted treatment of the neck can be beneficial for some patients. Have a look. Yeah, see what you think.
Oh yeah, absolutely. If I end up like that in 6 months, I'll be absolutely thrilled.
Yeah.
Much tighter, completely different actually. Yeah. Thank you very much.
That's all right.
No worries. Let's take this off and then
So
we
I
can
guess
draw
my
this.
immediate question is, when can I put makeup on, as in for this evening?
So,
Today?
I mean, if you turn to the left, I'm not sure if the cameras will be able to capture this, but these are these are the size of the insertion points. They're tiny. They'll probably seal off in the next couple of hours or so. So we're not really concerned about risk of infection with applying creams, makeup, etc. I always advise my patients to wait a few hours. If they can wait for half a day before they consider applying any further products, then that would be fine. That would be fine. But certainly from tomorrow, you can go back to normal activity. The only thing I would avoid is extreme heat environments, because that will tend to prolong the inflammatory phase. Steam room, sauna, sunbeds.
Retinol serums?
Retinol is going to aggravate irritated skin.
A
So,
normal moisturiser.
yeah, normal moisturizer, lots of moisturizing over the next week.
Yeah.
You can resume your retinol next week when the skin has recovered a little bit.
Okay, great.
I
I
always,
loved what I saw there.
sorry?
I loved what I saw.
Oh, in the mirror. I always supply patients with a face band, and we'll give one to you later. But by bringing the tissue close together, I find that it helps to it helps to reduce the amount of swelling that a patient gets. But also, you've got inflamed tissue planes now. Physically bringing them together and compressing them together, like what they do with facial, with deep plane facelifts and facial surgery, will help to bring those tissues together and produce a tighter effect in the next few months. So I ask patients to keep that on for about 3 to 5 days.
You've never had a small seroma?
I have had seromas, yeah. I've had seromas which I've aspirated. Yeah, you can either ultrasound these to make sure that they're predominantly fluid filled.
Yeah.
A lot of patients confuse a seroma with inflammatory fat tissue that tends to form this kind of this ball, which just settles, encapsulated. That settles on its own. I leave those alone. After about 4 weeks or so, they sort of gradually reduce and disappear. That's not a seroma. Yeah. Okay. So any further questions that patients or clinicians have, you can sort of direct those by the usual email channels. And we'll draw this session to a close.
Thank you. Thank you very much.
Thank you.
Thank you.
Let's take this off.
you.